and medicine fee. So cost processes is cheaper than the before admission and inspection medicine individual fee. This is a present Japanese, medicine cost system. Oh. Sorry. Previous. Next. Before. Yeah. No.
See, these two would be a better bet. Page up and page down.
I can use this point, so maybe you can understand these, figures. Period 1, first quality of all lengths of stay in each diagnosis group. Period 2, period 1, period 2, over period 2. We divided 3 terms. So period 2, average LOS in each diagnosis group. And period 2A is amount of payment per day for LOS shorter than period 1. And period 2B, amount of payment per day for LOS equal to or longer than period 1 and shorter than period 2. C is average amount of payment per day. D is amount of payment per day for LOS longer than period 2. This is system of DPC. After that, we make critical path. DPC will become a shortest term outcome using critical path. Every hospital, I think that doctor make a critical path when a doctor receive the patient. Before, as is means before, patient have to stay 2 weeks in one bed. But after DPC use, this is shortened only 1 week in a bed. So merit discontinuance of the drug and inspection without necessity. And inside of a hospital, health institution, admission fee will come double. This is point of DPC system. Conclusion. After medical data were concentrated to the center in regional core hospital, they are analyzed easily by medical staff. Before I explained. We confirmed that our proposal was useful for deducting cost and the shortage of doctors to solve the problem and to improve regional gap between core village and rural village in medical condition. Further studies. To collect real data by mobile van clinic and rural clinic, respectively. For the reduction of medical costs, real data will be calculated for using Markov model. Markov model, as you know, firstly 160 and 40, next 60, and 2020. It terms 3 years model. And third one, value of our proposal will be confirmed through questionnaires and interviews in India. That's why now I circulate my questionnaires for audience. So after my present, I collect questionnaires and I'm studying, referring your answer to next presentation. Oh, this is it. Finally, I'd like to say thank you very much, Apollo Group and Apollo staffs, because our Keio University, this mobile bank clinic study and research is assisted by Apollo Group. Thank you very much.
Thank you, Dr. Katsumata, for proposing a model that could reach more lives. In the interest of time, we'll move on to the next speaker. It's really a pleasure to introduce Dr. Arjun Kalyanpur, who is the CEO and Chief Radiologist for Teleradiology Solutions from Bangalore. He is going to address on the topic new model of healthcare delivery through teleradiology. Dr. Kalyanpur worked as a chief radiologist at Sathya Sai Institute of Higher Medical Sciences in Whitefield, Bangalore, where he set up a state-of-the-art department with a cardiac MRI and also developed a mini PACS in-house. In 2002, he left the Sathya Sai Institute and has set up this teleradiology solutions, truly a one-of-its-kind healthcare IT company, and it provides teleradiology solutions to several hospitals in US, Singapore, Europe, and now also to remote areas of India. Real pleasure. Welcome, Dr.
So do you want to do the video right now? No, just the PowerPoint is fine. The videos come through the PowerPoint. F5, I think. F11. Thank you very much, Dr. Ramakrishnan. I'd like to thank Professor Ganapathy for inviting me to speak at this conference, and I'm also very happy that he asked me to speak on this subject because the theme of this conference is transforming healthcare delivery using information technology, and I can't think of a better example of this than the field in which I practice medicine, which is radiology. So I'm going to be speaking for the next few minutes about teleradiology. And before we get into it, it's important, I think, to understand the setting in which teleradiology makes its impact. So if we look at the specialty of radiology today, and as we all know, radiology is basically the interpretation of scans, ultrasound, CT, MRI, X-ray, or nuclear medicine. The specialty of radiology today is in a crisis situation. And there are two very simple reasons for why this is so. One is too many scans, and on the other side of the spectrum, not enough doctors, not enough radiologists. So how did this come about? The reason it came about is over the last couple of decades, as we've seen, those of us who read the healthcare reports, there is a steady but insidious increase in the rise in the big three, which is cancer, heart disease, and stroke. And these are all diseases which require intensive imaging, initially for diagnosis and then subsequently for follow-up as well. So this is the crux of the issue. We have a population that's aging, and we have diseases that require more and more frequent scans. So in parallel, the technology has been advancing very rapidly. So the companies like GE, Siemens, Philips, and so on are developing scanners which scan faster and faster. So the number of scans being performed just keeps going up and up, but the number of radiologists is not rising to keep pace. Because to give you an example, a study from the University of California in San Francisco reported that the number of CT scans increased threefold between 1995 and 2010 in the United States. That's 3 times, but the number of physicians obviously increases at a small fraction of that number. So the result of all this is essentially that we end up with headlines like this one on BBC News, which is that there are very long waiting times for reports. And this is not just a phenomenon in the UK, this is a worldwide phenomenon. The United States has 1 radiologist for every 10,000 members of the population, and they consider themselves to be in the grips of a radiologist shortage. So you can imagine the situation here in India, where we have 1 radiologist for 100,000, or in our neighbor Bangladesh, where it's 1 in a million. And no country in the world today is an exception to this problem. So in such a scenario, information technology plays a very, very important role. And the way it does it in radiology is by allowing us to transfer the images from one location to another location for interpretation. How does this help us? Most importantly, it helps us by reducing the time to diagnosis. By bringing the images to the radiologist, you can expedite the process of diagnosis, and I'll be speaking in greater detail about this in a moment. Second thing is that it allows us to increase the quality of our diagnosis by bringing the images to the most appropriate or most highly trained radiologist for that particular imaging modality. Because radiology today has evolved into subspecialties. So you have cardiac radiologists, neuroradiologists, musculoskeletal, and so on. So if you can bring the images to that particular subspecialist, you can achieve a much higher quality of diagnosis. And finally, by utilizing the radiologists who are in short supply most optimally, it can significantly reduce healthcare costs. So that is another